What's up, everybody? Shawn here with another Live to Roll. Back with another great episode for you guys today. We're going to be talking a little bit about bladder management, bladder health. So if you have any questions, anything like that, drop them in the chat. Any comments, anything you want to contribute to the conversation, we'd love to hear from you. And we got our awesome friend Ray joining us. So let's get into some introductions and we'll get on with the topic. So I'm Shawn. I'm a C5, C6 quadriplegic from a snowboarding accident 21 years ago now. Tom, you want to go?
What up, everybody? Tom Conway, C6B, quadriplegic, going on 28 years. And coming at you from SoCal. Bobby?
Yeah. First, I just want to say happy life birthday today and to Cyril in the chat. So let us know how many years. So happy life day. That's cool. I'm Bobby Rohan, C5, C6. I think we have all C5, 6 club today. 36 years. Mine was the other day. So hope everybody's doing well. And I am so excited that we finally got Money, aka Ray, on the show. He always dressed like money, so I always called him Money. And a good friend of mine of many years, and we worked together at a couple different facilities. So I want to introduce our good friend Ray. Take it away, Ray.
Thank you, Robert. Shawn, thanks for the invitation. Happy to be here. Um, Again, my name is Ray. I'm a C5-6 quadriplegic, diving accident 32 years ago. Um, just happy to be enjoying the later years of my challenged disability, I guess you can call it. Many adjustments along the way, and yeah, happy to learn from you all and hopefully share some of my trials and tribulations.
Yeah, Ray, thanks for joining us, man. Today I've been wanting to have you on the show for so long. Every time I see you, I'm like, I got to have Ray on the show. Because you came on to Rolling Over the Hill with Bobby there, but we haven't had you on the Tuesday show, and I've been definitely regretting that and wanting to get you on. So yeah, welcome. Thanks for joining us. And another thing, I'm also trying to talk to Ray about maybe doing some gaming challenge and also maybe some fishing in the future. So some cool, hopefully, stuff from Ray and Push Rim and Live to Roll.
Awesome.
And real quick, before we do get started, just want to thank everybody in the chat. Welcome. Thank you guys. Happy Life Day to Sarah. And then I'm going to try to start making it a habit to very quickly thank our sponsors at the beginning real quick. Thank you to our sponsors. We'll make sure to do that again at the end. But a habit I'm trying to start building. So we do appreciate mobility professionals and urology professionals. And urology professionals has a, actually on topic for today. So talking about bladder management. So Bobby and I both have the suprapubic catheters. Tom has Mitrofanoff, right? Is that and does intermittent cathing, and then Ray, you do regular intermittent cathing now, correct? So we do have a little bit of a variety.
It's always blown my mind. Ray has always look. I don't know how you've done it all these years, but man, you've always blown my mind because you're doing the regular cathing, you're getting in those tight jeans, whipping it out and cathing, and I don't know how you do it, man.
Yeah, no, it's a transition from the beginnings from rehab, right? And then we see how our body works, and then we try to make adjustments, and other people inspire us to keep an open mind, right? Stay open-minded to try new things, but that's why, we evolve, right, as we go along.
Yeah, and that's what you also have had to kind of switch, right? Because you started. I think we've all kind of had to switch. Because I also started with condom catheters the first year of my injury, and just had struggled with it. Didn't really work out. And then, Bobby kind of was the one that nudged me towards the suprapubic and
don't blame me. Don't blame me, man.
Too late, bro. Too late.
No, I don't regret it. I feel like I've urged probably quite a few quads in the same direction, or not urged, but just kind of sharing my experience with it, and that I have had a pretty good experience with it, and it has allowed me independence with a lot of stuff, and being able to freely like empty my bag and be on my own when I need to in the day, to change from like a leg bag to a bedside drainage bag when I need to on my own, like so. But now I do have help most of the time with that because it's just a little more sterile for some of it, which has helped because I didn't have a UTI all last year, which is I think the first calendar year since my injury that I didn't have a UTI. So that is a pretty good accomplishment at 21 years, I think. um, but yeah, so you want to get into a little bit more of your story, Ray? You can start with you, and then we get into our stuff.
Sure, Shawn. Yeah, thanks. Appreciate that. So, leaving rehab, I guess all of us get diagnosed with a unique type of bladder, right? When they do the bladder function tests early on in our probably rehab stages and see what type of bladder. Now, all the terminology, I don't remember it, but I know my bladder was a type of bladder where if it reached a certain point, it would kick off, right? A certain amount of pressure in there and it would just open up and flood, right? So being a quadriplegic and not having hand function, um, I went through rehab with external condom cath into a leg bag. That was my setup, and it kind of it. I didn't know any better, if it could even get any better. Not knowing different alternatives so early on. So, I felt a lot of autonomic dysreflexia, right? Once the bladder gets full, and luckily I could feel with when I was full. I get a signal, and I'd had to put pressure on my bladder. They said squeeze your bladder, so you could squeeze, it'll open up automatically, and sometimes it did, sometimes it didn't. So I'd get bad AD from it. And yeah, so I would I'd go home, and I think 3 or 4 years later I was having a lot of leaking issues every time I transferred. I got to make sure that thing was connected properly. At night, I had that night drain bag and switched to a bottle drain, what is it? Bottle drain bag, I guess you call it, or that you put on the floor and you have a tube.
Yeah, I mean, you just got the bottle instead of the bag. I mean, it's same
Yeah,
thing. It's just a catheter or it's just a container or a bag that holds urine at night, so you don't have to wake
correct.
up in the middle of the night.
Yeah, but luckily I was a stomach sleeper, so I could sleep on my stomach for like 6.5 hours sometimes without getting up, and get off my bottom and my back, and it'd be good for my hip flexors. Um, but yeah, so later on I got tired of it, and was reaching out and finally met a couple wheelers that were quads that were catheterized. And how do you do that without any hand function? Well, it's a trial and error. You got to try with the straight cath first and drain into a bottle, and then see how that works. And so I just practiced, stayed home. I had a bunch of towels and chucks under me and my pants halfway down, and a bunch of catheters ready, semi ready to go once I needed to go, and just stayed home for 2 weeks and practiced. First week was rough, man. I was wet everywhere. I couldn't get the catheter in. Yeah, I was too late, so I was playing the timing game, how much water to drink, and just getting to learn how my bladder works, right, and when I needed to go. And by day 7, I was like, okay, I think I got it, and then it just got better from there. So then I started going out. So I was pretty much hibernating, practicing on my own for about 2 weeks of just trying to work it out, and finally got it. And with the help of the medication, right, the spasm relaxing medication or muscle relaxers, right, to prevent a spastic bladder, which is known generically as oxybutin, right? Um, I that helped as well. So yeah, but it was definitely, I started off with sweatpants everywhere because it was easy to pull down. And then my mouth was used as a catheter holder. I would hold the catheter in my mouth and let it hang down, and I'd get myself ready and then just kind of clamp the catheter with two hands and try to wiggle the head of the catheter between two fingers. And the other, I would have my pants pulled down and, you know, my member pointed up and just try to nail that little hole there. And once I got that in, I just go shh, right
So
in. And
That's-
was it like, but was it one of those the slippery or what are they now, hydrophilic catheter at that time?
Yeah, hydrophilics were just coming onto the market, and I did try the KY jelly based ones, but some of them were a little bit soft. So to wiggle that thing in there, it would bend all the time, and I was like, oh no, it's not gonna work. So thank goodness at the Abilities Expo and talking to other people, I was able to meet others, catheter companies that were able to send samples, and then end users too that been using them for a while, and they suggested themselves. So trial and error, and full speed ahead. I mean, I've been like 25 years probably now, catheterizing with a closed system catheter now, but it's been so far so good. And I don't close my mind up to different solutions in the future because you never know how our bodies are going to change, right? Our bodies might change and you have to make adjustments with it. So, I'm glad Bobby has a different setup, Shawn, a variety of people are in different systems that we could pick their brains on, and maybe in the future might have to make that jump to that setup, right? It could give you probably more independence in different ways and a better quality of life, right? Because that's what we're looking for at the end of the day, right? Stay out of the hospitals, less antibiotics, and be able to go out and enjoy the outdoors and travel and do all the fun stuff. So I hope that
How
answers some of your questions there.
no,
how
that was
often do you
perfect.
how often do you cath and how long does it take you?
So I have a timer now. I'm on a timer system of every 3 hours. I drink about half a bottle of water between those 3 hours. Uh, and yeah, I should be drinking more. But at night, I still drink and have to cath every 3 hours. Um, just because I don't have the sensation of when I have to go now. If I don't go on time, my bladder would just open up and have an accident. So I have to be pretty militant about that. And
So do you
luckily,
like, do you set an so you set an alarm and then you wake up and then just do your cath and,
well, at night, I don't have to wake. I don't have to set my alarm anymore. My body clock already knows. Like the most I can lay on my side is 3 hours. Then I got to turn or get help turning, right? Just to make sure I don't um, overdo it. But during the day, I'm on the alarm clock. Once that
And
thing goes off, I know it's time to pay a visit.
Are you
and
able to do it as functionally in bed as you are in your chair? Or is it easier in bed?
Uh,
Is it easier in your chair?
so I have one of those beds that sit up, right, with the remote. So, I mean, it makes it easier that way because I get to make it come up, and then I have to kind of open my legs and kind of balance myself. And yeah, that part's easy, but it's just another break in my sleep, right? That we have to do that routine. And um, I mean, an alternative is external condom cath and just drain into that, but then I'll be going backwards with I don't know how much my bladder is opening up to empty out, right? Because sometimes you don't void all the way out, you still leave some urine in there
mhm.
if you don't go in there and get it out manually. So, um, yeah, it's a balance.
and do you
And
want to real quick also, Ray, explain why you are doing a timer now? Because I know previously you used to just be able to do it from sensation of knowing you're gonna have to go and then go, but I know you said you had a procedure that kind of changed that.
Yeah, so 3 years ago or so, my T11 vertebrae it just wore out from all the grinding of the years of pushing and bad posture and bending and it pretty much broke. So I had to go in there and get uh, just surgery, rods and screws, and a metal cage to replace that vertebrae. And when I came out of surgery couple weeks later, I noticed the sensation of my bladder being full was no longer there. So I think the surgery affected it somewhere, maybe the inflammation, some scar tissue. You know, those nerves are very sensitive, especially lower level, right? When you get to
Mhm.
the T's,
You're a parent.
T11s,
Now you can
right.
say you're a paraplegic.
Yeah, I could cover all ranges now, uh, from pair to quad. But luckily, I came out winning in no pain, right? I mean, I'm already a quad. I shouldn't get too much, but our pain manifests itself as autonomic dysreflexia, right? Most of the time, and some nerve pain here and there, but you know, for the most part, it's good. I kind of took a step backwards and now having the cath more often, right? But I
Mhm.
still was able to independently cath myself while I'm out.
You know,
Barely.
I have two questions. Like,
Yeah.
one, when kind of with the UTIs, I mean, we're always curious about that, but like when you first started trying, did you get a lot of them because you're like fussing around and probably not the cleanest technique? And then what are, now with 3 hours, and I mean, I can't even imagine every 3 hours because like at the Abilities Expo, like, there was so many times like for an hour, I'm like trying to get to the bathroom and being, you're popular like I am at a show like that, and you're like, hey, Ray, and you're like, you're talking, and I got to go pee. It took me like an hour one time to try to go to the restroom. Finally, I just told this person, I'm like, I'm gonna blow up if I don't get to the bathroom here. But so, like, what is that UTI situation like now?
Yeah, that's a good question. So before, I do remember getting a lot of UTIs before when I was on externals. I'd get them like 4 times a year. When I started catheterizing, I still got them maybe 3 times a year. But then as I got my technique, a cleaner technique, less, exposure with the catheter and touching it, I, I got, I went down to probably 2 times a year where I got UTIs. In the last 5 years or so, I think I've been pretty good where I'm maybe one UTI a year now, which is pretty good. And I know when they're coming on, I get these weird body feelings and lower back spasms and maybe a couple leaking incidents where I know I have to either take some right away or get it checked out so I could knock out the infection. But yeah, that's something also that we have to be mindful of when we're experimenting or making
Mhm.
transitions to cathing, right?
When
Yeah.
you in between like your intermittent cathing, do you ever leak when you don't have an infection, or is it pretty sealed up?
Yeah, actually, when I'm on top of my oxybutin and take it religiously, like every 1 pill a day, I do pretty good during the day. I could hold the maximum amount and not leak. If I go over my 3 hour period uh, into 4 hour territory, that's when chances are the bladder might open up and have some leakage or,
What's your
some
maximum?
accident. I'm sorry.
What's your maximum? Like how much can you
I
hold?
hold yeah, so that's a good question. So I think I got out the other day. I was even surprised the bag could fit. I think I was in the 600 cc area, maybe seven. Um, but I also wear a stomach binder to give me a little more posture and support. So that affects how much pressure you're putting onto your bladder, right? When you wear a binder or you know, um, some kind of stability support, or you wear a
I really
belt
sorry,
or
you guys. I'm gonna take this call.
sure. Yeah, so that's kind of my my setup, and I rather go early and get less residual than take a chance and have
I,
some issues.
Have you thought about for at night? I know you said it doesn't matter because you have to shift anyways every few hours at night. But
Yep.
have you thought about trying like the condom catheter at night, like, and then just making sure to use the, you know, intermittently cath in the morning to make sure you get a full empty for the morning. But I don't know. I just was trying to.
No, Shawn, that's a good point, and I think that might be something I'm going to start experimenting with. Because I'm tired of laying on my side and having a pad next to me. You you know what I mean? Just in case some
But would
does
you?
leak out, and
I almost see that as
yeah.
like being nervous to let your bladder like go freely at night, and then you got to try to hold it during the day, and it just seems like over time that you might get that leaking more often because your bladder's like, hey, is it? I don't know if it's night or day. I want to just go right now. So would that be a worry for you to do that?
Yeah, yeah, no, yeah. And I think when we lay down and get off of our really, because when we're sitting, we're putting pressure on our bladders, right? Because our weight, our stomach, if you have one, uh, I'm
Especially,
exempting Sean from it because he might not have too much stomach. But
well, I was gonna say, well, most of us quads sit with a lot of bucket, like dump in the chair, so it kind
yes,
of does
that's
put that
another angle.
fold on, like right where you kind of fold it up a little bit on your
That's
bladder.
right. So
Yeah.
that's some bladder. So when you lay on your side, you're relaxing your bladder, and maybe water flows through your body a little differently, right? Because some people say when they lay down, they pee a lot, and another thing I notice is I got to be careful around like blowing fans on my body while I sleep because I notice
Oh,
fans.
wait,
S-
what? You're a
yeah,
quad? No
bro.
way. No
Yes,
quad has a
sir.
fan. I fight a
Man.
fan in the summer. Like, no, 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 no. Like, oh man, that is crazy. You have
Yeah,
to have
bro.
one of those. Wow.
Well, our body temperature is so out of whack. Sometimes I'm freezing, like even going to bed, it takes me a while to warm up.
Yeah.
Right? I gotta go throw comforters, I gotta throw extra blankets on my legs, and an hour later we finally normalize. But then you wake up at 3 in the morning sweating because you're overheating because you got all this stuff on you. You're like, hey, let me get some air. I'm hot. Especially laying on your side for 3 hours, your body tends to get a little warm. I mean, mine does at least.
Good. It's oh my God, this chat is going crazy, and I want to answer like so many and comment and Ken. Yeah, I'll show you one quad that doesn't have a quad belly. It's called uh, Shawn Fluke. He does not have a quad belly, but we found out why. He weighs 100 pounds, dripping wet. Um, so there's your answer there. But yeah, I hate my quad belly. Um, there was so many from. I think Dion and Leon. I think with that suprapubic, you guys were talking about trying to cap it where you can expand that bladder. And I'm in the same boat as you guys. I cannot cap it, for a nanosecond. I mean, it just like I'll get AD right away. Um, Recently, for some reason, I don't know why, I haven't had a bladder infection forever, but I'm now having to change my suprapubic every 10 days, if not nine. I just, for
Oh,
some reason, I'm plugging a lot quicker. Um, I'm a 20 French, and I noticed you guys were a little bit smaller than me. I know that Sean shared that he's a 24. Um,
yeah.
just last week, I tried to shove a 22. There was no way that thing was going to get in there. Yeah, it was just like, it ain't gonna work. And so that's a bummer that I can't go. And I'll try again. I'm not shy to not try it again, but I just can't last as long as I used to. I mean, there was a time where it was like 8 weeks in. I was like, holy crap, I better change this sucker. And that was back in my 20s, and I've had mine since day one, 36 years.
Yeah, and that's
And
what I've kind of experienced that too, where I went from originally doing it once a month, then going to every 3 weeks for a lot of years, and then now in the last year and a half, we've switched to 2 weeks, which has helped actually because, um, yeah, so the changes are easier, and I'm not getting it stuck. It's not having as much like sediment buildup and blockage in there. Um, but yeah, so
Got a
I'm a 24 and have to do it every 2 weeks still. So.
So I got a question for you both on that. When you decide to get that procedure or are forced to get that procedure for medical issues or complications, do you guys have to have that conversation with your surgeon or doctor and figuring out what size he recommends or what size you would like to have that diameter of the catheter before you do the surgery? In case in the future you want to go up or down, that might not be an option, or that might be an option. How do you decide that?
Um,
Go ahead,
I
Shawn.
was gonna say I don't fully remember if he gave me a size. I know I started smaller. I don't know if I started at an 18 or a 20. Um, but I did increase like I twice I increased it. I think it was from I think I must have started at 20, and then I went to 22, and then eventually 24, and that was just because I was having a lot of sediment and getting a lot of clogging and blockages in the catheter, like during that month. It was like still it was more and more of an issue, and even with flushing, it just wasn't working. So I was able to in the earlier days. I don't honestly remember what it was like, if it was like I was getting a lot of AD, or how the struggle was for when they did have to like put the larger one into stretch. Um,
Right.
because that was a lot of years ago now. I did that probably the first few years in my injury, so it's probably been like 17, 18 years now. Um, so I don't really remember, but I know I did do the slow increase. So you can increase or decrease, I believe, in size. Like decreasing, I think I was told like you would probably have some leakage for first few days or maybe possibly around the site, but the site does close so fast it'll basically shrink to that size pretty quickly. I think the
Okay.
stretching is a little harder, but
Yeah.
Mm.
And to answer your question, Ray, I don't remember. I think I was always at 20. It wasn't a discussion. I just basically remember I was still in rehab and I was having a lot of problems with the condom cats. And I had a very spastic bladder and I didn't want to, even the medications, the ditropan and what you're on just didn't work, And so I my OT told me about it and had me talk to somebody on the phone, and he just like, this is great. It's great because you don't have to do this and this and this, and then said something about sex, and that was all it took. And I was like, oh, really? I'm 17 at the time. I'm thinking, wow, okay, if that can make something easier in my life in the future, that would be nice. Um, and so I don't remember
Yeah.
what it was that I started with, but I have heard lately of people telling me of them starting out at 16 or, yeah, a bunch of times at 16 when um,
Wow.
I
a
feel like
nurse
that's
said
small.
one time, she's like, you're at a 20. And then she was telling me problems with another person of hers, of somebody she was caring for, and she's just like, yeah, she's having all this problems of plugging, and I'm like, what size? And she's like 16. I'm like, that seems too small to stay
Oh,
in somebody's body.
yeah.
So it's weird, and I guess I imagine, and being that we were up to 39 years at one time right now, but I would tell people, if you are thinking about a suprapubic, that maybe that you should look into, or that's a discussion you should have with your urologist. I don't remember
Absolutely.
that discussion at all. That
Yeah.
was so long
So,
ago, but that is interesting that I guess, it's something to have.
And
And
yeah.
Darren in the chat just said he went from a 16 to now a 26 slowly, which so he's the only. I've never seen anybody that had a bigger
I
than
don't even know.
24 with me.
You mean,
Yeah.
no, he went to 16 to 18, I thought it said.
No, that
That's
was
cold
Jay in the
turkey.
chat. They
Okay.
just went up. Jay just did that. But Darren
Okay.
said that I was a 16 gauge suprapubic and had trouble with sediment
Oh,
and
I see.
slowly
Right.
went up to 26. I went up a couple at a time. So
I,
probably
I've
like
never,
So,
16 to 18 to 20 to 20. But damn,
I've
that's
so
never
a
even
Sean,
seen it.
Sean, the reason I asked the question is because I want to find that sweet spot to have that conversation with my urologist in the future, if that's where I want to go, right? And if people are saying 24 and some people are saying 16, I'll probably have the conversation like, "Hey, doc, can you stop me around 19-ish, 20-ish,
I think they're
just so
just
I don't have to
even
go
there.
through all the challenges that I hear, and go from there, right?"
Well, really, it's actually Tom chime in man, because you're and for you, Ray, I think you should go the way Tom did it because you're used to cathing, and Tom is doing basically cathing with the Mitrofanoff of
That's it.
going. Say that again.
I was gonna say actually we have a couple of chat questions. I was gonna try to direct
Yeah.
to
And
Tom.
so, Tom, I don't know if you want, to chime in here, what it is. And because I think, what you've explained in the past, it's a form of cathing. And that's, did you,
Uh,
did you start with a certain size or have that discussion? And how is it for you? Because it's something I wish I was doing now instead of maybe suprapubic.
and also, real quick, Gretchen had also asked about bladder augmentation surgery, which is another one. Tom also does have the experience and knowledge with that as well. So if you want to tackle either of those, Tom.
Yeah, I only got a minute because I got a stupid nurse showing up. So I'm gonna have to pop off here, but let me just do my best in the time that I got. So yeah, I have a bladder augmentation. Gretchen, you were asking about that earlier. Basically, I had what's called a neurogenic bladder from being injured. So early into my adolescence, my bladder did not grow or stretch out to the size of an adult. So I had a very tiny bladder, could hold maybe maximum like 100, 150 cc's. And before I was AD, before I was leaking, before, like my bladder was so stressed, I was getting UTIs constantly. So they had to do a bladder augmentation. They took some of my small intestine tissue and they sewed it onto my bladder and increased the size, kind of like a balloon on the side of your bladder, just to increase the capacity. Now I can hold like on a 600, 700. I'm floating like my bladder's full, but I've held like 1,000 before, um, and that's like max, max, max. Um, and Jay, no, nurses aren't stupid, but this agency that I'm dealing with is, and this one is. So um, I'm a reserve judgment on the rest of them, but this one sucks. Um, I just communicated to them 50 times that I have this show today between 3:30 and 4:30. And when did they show up? At 4 fucking o'clock. It's just frustrating. But any case, sorry, you guys. Just getting sidetracked. So I also have a Mitrofanoff. Mitrofanoff is a really cool procedure that basically moves the port in which you cath from your urethra, which is what I was doing for the first 15 years of my injury, cathing through my penis, through my urethra, just doing regular intermittent cath like Raymond does. But that wasn't really realistic for me to do independently. I didn't have the strength or the dexterity to remove my pants and to manipulate the cath to catheterize through my urethra effectively and independently. So when I was getting the bladder augmentation surgery, my urologist offered me the Mitrofanoff procedure. He said, "Hey, we can take the same tissue we're using to do the augmentation, and we can build a port right here in your abdomen, right next to your belly button, or even in your belly button if you like, and you can just catheterize through that directly to your bladder." It's really cool because it's the way that they engineered the tissue or sewed the tissue is there's like a fold in the tissue that the catheter pushes past to get to the bladder. And the reverse pressure of the bladder being full actually pushes that flap closed. So it doesn't leak. It's like a one-way thing. The I'm able to just lift my shirt up and manipulate the catheter. I don't use a hydrophilic, just like you mentioned earlier, Raymond. They're very, very
Uh-huh.
slippery, and it almost like I need a little bit of tack, like I need a little bit of like something to grab onto to be able to manipulate the catheter with enough dexterity to get it where it needs to go. And yeah, like Raymond, I catheterize every 3 to 5 hours, sometimes more frequently if I'm experiencing UTI symptoms or if I'm drinking a lot. Sometimes I'll push it a little bit if I have a really busy day. I will like drink a little bit less water to not have to maybe cath as frequently or as often. But that can end up biting me in the ass if I push it too far and end up with, like a little bit of a UTI or something as a result. So I try to stay really religious and consistent. I don't have a timer, but my body talks to me too, like Raymond. I can tell when my bladder's full, like I get some nerve sensation. I've had that for 28 years and haven't lost it yet, thankfully. But I haven't had any major spine surgery either. So yeah, my bladder talks to me and tells me when it's full. So that does help me manage it better. Like I'll just pee when I know that I need to pee. It helps me push it a little bit if I need to stretch it an hour or two. But also it tells me if I need to cath more frequently, if my bladder's full, or if it's just angry from, UTI or something. I'm really grateful to have that indicator, like my body communicating that to me. And it changed my life. I wouldn't have been able to move out, be as independent as I am, without my Mitrofanoff and without the freedom and the ability to cath independently and manage it independently. It's just I wouldn't be able to do it. Period. So
Two,
really
two,
recommend it. Changed my life.
two quick questions, Tom, before you have to go. Catheter size and how much output do you get with that system?
14 French. They engineered the port again. I don't know exactly how they did it surgically, but the and how they got, like, I had an indwelling cath like in the Mitrofanoff for like 6 weeks after my surgery while everything healed, like around the catheter, and I think it just kind of healed um, based on the size cat that they put in me at the time. I haven't needed to adjust the size or anything. I recently just tried a new catheter called a luge through Coloplast, and instead of having like two holes at the end that are a little bit bigger, it has like a bunch of tiny holes like further up the catheter. And the idea was that I was going to be able to pass more sediment or more mucus easily. That was the other thing about my procedure is they use tissue from my small intestine. For anybody that doesn't know, your intestine is made up of these cells called goblet cells, and they generate mucus just like the inside of your sinuses. And that mucus is important for your digestion, for your digestive tract to help, like, the passage of like stool and stuff. But the cells still generate mucus, even though it's in my bladder now versus in my intestine. So that's like something that's a not so awesome side effect of all of this. Shit, I gotta go, you guys.
Oh, thanks, Tom,
Um,
man.
But yeah, no, thanks for the
I've
info,
talked
Thank you,
about
Tom.
this
Tom.
a ton. I've talked about this a ton on a bunch of other episodes. So if you guys are looking for more information about my stuff, um, check out the other apps. And yeah, love you guys. Peace.
All
Love
right.
you, Graham. That was
Yes.
funny, and he made a comment that I've heard about that new catheter coming out, and they're trying to make it. They don't have it yet in the 20 French or the bigger sizes, but it's got those multiple holes. So for guys like you, Leon, Derek, Suprapubic guys that have chimed in, we're hoping, crossing our fingers, that we won't, that sentiment won't get as clogged up as easily. And also something that I can talk about with my suprapubic. I don't know if you're doing it, Shawn. I think you said you are on one of the shows, but I use a silver alloy catheter. So for those who have to have an indwelling catheter that's sticking in your bladder for that long of a time, it's a coating that prevents some of that bacteria sticking to that catheter and then causing those UTIs.
Mhm.
Yeah, and that's what
Yeah.
I am looking into maybe trying one in the future. I actually had tried to switch to from latex because I've always used the latex. When I tried to use silicone early on, it just didn't. They were super rigid and just gave me AD constantly when I had them in. The newer, I tried a barred silicone catheter, which is like the same size, same make, same, pretty much identical to my latex one I've been using by Bard, but silicone, and it was better. I didn't completely have AD and pee myself constantly, but I had a constant mild AD, and when I would transfer, my AD would spike pretty much every time, like because I was bending and moving it. So I'm back to just using a straight latex one. I do maybe want to look into getting the silicone coated. I was actually going to try to see if I could find a 24 French one that might work. And I was thinking, because I'd really like to even push back into like closer to 3 weeks or maybe 18 days. Like I think, was it Leon or Derek? Somebody mentioned in the chat they just went from like 21 to 18 early on. Maybe something like that would work for me. But yeah, right now I'm using just a straight up latex 24 French 10 cc balloon, or the 10 mil balloon, or 5 cc 10 mil, I think, or whatever it is.
It's got to be.
And I don't fill it all the way. I only put 8 milliliters out of the 10 in it.
Yeah, I put 4, maybe 3 or 4.
But you don't lose it, because like when I changed mine this morning actually, and what I've been doing is I change it every 2 weeks. So in the week in between, I have been adding 1.5 milliliters to the balloon, and I didn't this time. And so when I emptied it, it was 6.5. Like I lose exactly 1.5 over 2 weeks or something, whatever that works out to be. And I noticed that I feel like a little bit more discomfort when it's smaller. Like it's moving around and they're jiggling more. I get more.
Oh, really?
Yeah, a little bit. I mean, that's what it seemed like to me, at least.
They were talking about in the chat about being out. We've been on a Suprapubic for so long, and sorry to hear, Ingrid Quad, if you're no bueno in bed. That sucks that you're down. And I don't know about you, Ingrid Quad, but a lot of us have mentioned earlier in the chat, our bladders have shrunk so much. And so I'm always worried about even doing 5 cc's, just because I'm like, there's only so much room in there. So I just want to make sure that it's got room for it to hold at least, when your leg bag fills up and you're like, 5 minutes from home, you want to make sure you have it enough that you're not, and I don't leak out anymore. And I don't know about anybody else, if anybody can comment on this. For a long time, if my bladder was full, I would void out my urethra. And so then next thing I know, I'm wet. And then for the longest time, it started happening out of where I insert my catheter out of the hole. Now it doesn't do anything. Now I'm just in a, if my tube is clogged or my bag is full, I mean, I'm like ready to burst out the seams. I would hate to take my blood pressure, but I got the worst headache and I'm sweating and I'm just soaked. So it is just weird how it has changed. And I don't know if that's for anybody else.
I mean, mine's definitely seems like it's gotten really sensitive over time, like my whole bladder area. So even right now sometimes, and I don't know what this is, but like I used to, like in the shower, be able to like spray pretty much right around the catheter to like, clean, especially after a catheter change. Sometimes there's like, gunk, whatever, like stuff coming out of there, mucousy buildup stuff. I can't do that anymore. If I spray too close to my bladder with the spray, even when it's turned down pretty low and it's not even crazy pressure, it will make my bladder spasm super hard. Like I can see like it suck in like really tight. Like I could see the muscle and the tendon, or I don't know what the hell it is, shaking through my like bladder, and it'll give me the wildest spasm where like it pulls my I've almost fallen out of the shower chair, but luckily have a seatbelt on. Like one time I was literally yelling, but Leah was out in the kitchen doing stuff, and she can't hear. She has a slight hearing issue. She has a hearing. She's not slight, but she's can't hear very well. She has hearing impairment. So the dog heard me and ran out of the room and started barking and got her. He's like, yo, help. And then she was like, what? And then as soon as she got to the room, she heard me like saying help. But yeah, that was luckily the dog heard me and ran out there, and the seatbelt kept me from going down. But yeah, I literally can't even like touch or like spray or like right around. My bladder is incredibly sensitive, and it's been like that for like a whole year now. So I don't know what that is, if anybody has that issue as well. But
I'm probably sensitive in that area, but not as sensitive as that. So that's um, I'm more sensitive in my groin region. Very sensitive nowadays. Um, Not when I'm sitting, but getting dressed, um, pulling up the underwear. It's very very sensitive, and I don't know what that's all about.
Yeah, no, that's it. I feel like it does change a lot like that with
Yeah.
time. And Ray, have you had any
Yeah.
other? Yeah, I know.
Uh,
Angry Leah has selective hearing. She just told me
Yeah.
she has a hearing impairment. That's just because she doesn't want to hear me.
Yeah.
Sometimes she's like, "Well, I don't know." Like,
well, she has the option to pull that card anytime, bro. So it comes in handy, I bet. Just speaking about technology, right? So the beautiful thing about the Abilities Expo is that's where we get our main updates on new catheter technology, new equipment and things of that sort. And I did hear about the catheter with more eyelids. And actually, I'm supposed to get some samples sent out already just to try them out. But I think the other piece of the reason they explain, instead of having two holes to drain, they put a lot of small ones, and it not only helps drain it faster, but it works as some kind of suction vacuum system where, kind of like a funnel, right? When you suck water or those movies when you suck gas out of a funnel, it just keeps flowing. So that's kind of the idea of the that technology where all the little holes and it's draining out faster. That momentum and suction will help more completely drain your bladder.
Mhm.
At least that's how they explained it to me.
Yeah, and
that's
I can
cool.
imagine with more of the tiny holes, so the two bigger holes, the sediment isn't gonna get up there and plug that area as well.
But see, that
Uh,
would make me a little worried that I'm not getting the sediment out. Would my
but see, it's
that's
not going in. It's not going in because now there's
Well, and
tiny.
and and another part is if the little holes on the bottom get clogged, you still got six other holes on top that could clean up
okay. Yeah,
Right.
the other stuff. So it could work like that as well.
Yeah, we'll see. Hopefully, it comes out and sounds like Tom's having success with his. And if they make the bigger sizes, we'll see. So hopefully, knock on wood, that will start helping out and making things easier for us out there.
the other one, I wasn't sure if they're talking about that or the somebody mentioned like the dual balloon or something. And I remember looking into that years ago. Somebody had sent me one, some info on that. And what it was so instead of having the catheter tube and then it fills up the balloon back here, and then it has like that tip that sticks out where it, sucks in the urine, like on a suprapubic or an indwelling catheter. It actually had two balloons. So it had one balloon up and then one balloon at the very end, and the intake holes were in between the two balloons so that there was nothing poking, like nothing smaller, like the end of the catheter tube. And then I also used to have a friend, I think the person that sent me that, I think it was Dylan, that does Zook Fitness. He, for a long time, and maybe still does, on his suprapubic catheters, he would have the nurse, before they inserted them, um, use a pair of sterile scissors and clip off the bottom of the catheter under the balloon. So there was basically one giant hole under the balloon instead of the two little holes on the tip, and there was no little dangling tip that stuck out the end of the balloon. It just basically was one balloon that was inside of him. And he said that worked. He had been doing that for like a couple of years now. So I don't know. Just things to ask the community, find out different things like that.
I
I
would talk to your doctor before maybe trying something like that.
I think he
And
did, but I don't know.
I think that's something we should say here on Lit to Roll, that make sure you talk to your doctor before something like that. Something that would make me a little leery about that. It sounds like an awesome idea, Shawn. Don't get me wrong, but like let's say just little tiny, it wouldn't be fiber, but one of the little rubbers that happen to just peel off into your bladder, causing more damage. So just be careful.
Well,
And I just wanted to address Mo Crew. He's been hurt 5 months. So while you are a newbie, I'm so glad that you're here listening to all this good information. And you just got your suprapubic. It was the same for me. I got mine 4 months after my injury, and it's been 36 years later. So that's, something for you to look forward to, that, it is a long lasting solution to make it easier for you, instead of cathing over the many years. Because I've had a couple doctors go, that's not a long-term solution. You're not supposed to have that more than 5-10 years. I've had a few doctors. And it's so funny, Ray. Ray, do you still go to in Long Beach?
Yep.
Yeah, Dr. W. And I guess I could say his name. Dr. Wax is, a big deal here in our spinal cord community for urology. When I first tried to go to him, he was like, "Oh no, you got to get off that. You got to get off that." And it's so funny now he's doing it a lot, is what I've heard through the grapevine of people telling me, "Oh yeah, he's good with it now." So he was one of those that that's not long term, but here we are sitting 36 years later, fine.
Yeah, well, that's the thing. When I first got hurt, he was my urology doctor. And, back in the days, spinal cord injury, bladder management evolves, right? So in 30 years, of course, he's seeing more people. It's changing people's lives. And the key thing is management, right? If you could manage something in a way that reduces UTIs, hospital visits, that's key because every system is different. The only thing I could share is don't be for speaking for myself. I've always been a person that gives time uh, in a new system to learn it, and I give myself up to 6 months to a year to learn something new, especially a big change that I'm going to make dealing with surgery, because I just don't want to deal with hospitals and surgery. So it, in 6 months to a year, I think I'm going to be able to know if this system is going to work for me, or if I'm able to adapt myself enough to be able to do it independently. That was my train of thought. That's why I hesitated jumping into surgery right away after my injury until I figured out what other people are doing, what the technology is like, what medications are out there to all work together to make it work, right? Because
Mm-hmm.
sometimes you might grab a medication, but you don't know the techniques. And sometimes you know the techniques, but you don't have the medication. But if you bring all these three experiences together to make it work, it's like a puzzle. You put the puzzle together, now you're styling. It's working for you. And you run it as long as you can. And like we talked about earlier, you get older, your body changes. Maybe you have to go to that surgery later, which is, that's something you need to do to stay healthy and have a good quality of life and independence ultimately.
Yeah, totally right. I mean, and and not to say you're not unique, Ray. You are unique in a lot of ways for some of the great things that you do out in the community. And something that I would love for you, before we log off, to give your nonprofit a shout out, push rim. But I do know some others C5-6 quads that do cath, and our one of our family members from Littoral, Paul, who's on our Rolling Over the Hill. He still cats, and I've known a bunch, and I think it's just what works best for you is that's the way you should go. You shouldn't be listening to, unless there's an issue, then you should be listening to what else can be out there. And not to switch real quick, but one thing I would like to know, and something that has changed for me, is my vitamin C. My urologist, slapped me on the hand and this was 2 years ago, when I told him how much vitamin C I take. and I have upped it to 2,000 milligrams, or I think it's the mg. I'm not. I'd have to look again, and but it's 2,000. Usually, when you buy the bottles, it might be a 500. There's some out there that are 1,000. I get one at Trader Joe's that's 1,000. So I take one morning and night, and since he got me on that, it changed my life. Knock on wood, I haven't had a really a UTI that I can say that is like really putting me down. I might notice something and maybe a little bladder spasm going, something might be up, or that maybe a different smell that I'm like, that's not good. Let's make sure we get on top of that. But really, the vitamin C changed my life. And I know some people out there earlier, and thank you so much, everybody in the chat. You guys just have been amazing. I can barely keep up with you going so fast and everybody chatting away, and I'm happy for that. But some people talk about the demonos, and cranberry pills, another one, and some people just even say they drink cranberry juice, which I don't know how they do that. It's nasty if you get
Yeah.
the non-sugar cranberry juice.
Yep.
But, is there something that you're using, and this can go for you, Shawn? Do you take something like that to help keep your bladder healthy?
So for me, I can go, I guess, and then Ray, if you want. But I
Sure.
do, I do the Hippocrates methylphenidate with
And
as
yeah, and I do that as well too.
so
So
I do that as a daily kind of preventative. I also do regular cranberry, which has vitamin C in it as well. It's a cranberry with vitamin C added, and then I also do D-monos. I do cranberry earlier in the day, and then D-monos at night, and the Hipporex both morning and night. Um, those are the main things I do for preventative. Try to drink a lot of water. I don't drink alcohol or anything anymore at all. That was really hard on my system. And then even like sodas and other things, I try to at least limit. If I'm having one, I just like one a day with a meal, like a soda. Like no like drinking things of soda all day or anything like that. So just yeah, those are the main preventatives that I do for maintaining, trying not to get any UTIs and infections. And then now just making sure to have very sterile like changing catheter changes and like bag changes and all that, and keeping the bags very clean and sterile as well. So, which those I have to shout out. She does all that work. So,
Shout out. Yeah. Yeah. No, Bobby. For myself, Shawn, I think Bobby. Vitamin C. I always have him on hand. I alternate vitamin C with organic boiled hibiscus flower. I don't know if you guys ever experiment with hibiscus. I
mm,
come from a Latin family. We call it agua de Jamaica. It's a purple. It turns purple. It has a tarty taste as cranberry, but it's all natural. It's all non-sugar. Yeah, it's gonna have a bitter taste, but if you know you're in there, helping flush out and maintain your urinary tract. I was explained by my urologist that your kidneys, when it goes through the process into your bladder, it has a lot of little filters, right? Very tiny microscopic filters, and it seems like the vitamin C, the citric acid and vitamin C, this is how he explained it to me, is really good at penetrating through those fine little filters to flush out any sediment that might be left in there before it goes into your bladder. And your bladder is a whole different environment. But even hibiscus, I drink that. I look at my urine. I almost want to take a photo and put it on my wall. I always show off when I'm cathing and be like, man, I had the best pee ever, man. Look at this thing, man. I could see right through it. And I take pride in that because it just shows me that I'm doing my due diligence and making sure I do my part because no one's gonna take control of your health like you are. Um, and by having these conversations, which is so awesome, Shawn, is we could take it back to our professionals, our urologists and doctors, and be like, "Hey, doc, what are your thoughts about me changing my system? Is this going to hurt me?" And let him be your guidance. But it seems to be working for other folks. It doesn't mean it's going to work for you necessarily. But if your doctor gives you the blessing, and then you could think about exploring some alternative, more holistic approaches to your care.
Oh
Yeah.
yeah.
And so, do you grow your own, or do you get it at like one of
I,
those shops?
I wish I
For
had a I wish I had a backyard to grow it because I definitely would. But no, I buy them dried up. They're usually in bags that are dried up, and you just boil them and let them change color, and just put it in your water bottles and or cold drinks, and you could add a little if you want to sweeten it up, a little dab of honey or a monk fruit sweetener, some just spice it up a little bit, and for those people that are watching their sugar levels, and obviously my doctor said that sugar is food for bacteria. So when he said that, I'm like, why am I drinking this cranberry juice that has 15 grams of sugar? Isn't that
Yeah,
counterintuitive and all this stuff? So I play it on the safe side. If I'm going to be flushing my system, I'd rather have, and then if I want to have a cheat day, like Shawn mentioned, yeah, I could have my Coke, my cherry Coke, you know what I mean, and maybe later chase it down with some water just to dilute some of the sugar. I don't know.
Hey
No,
Ray,
yeah.
we're getting close that we're gonna have to wrap up soon, but it's just started because Leah did a shout out for your push rim. Tell us a little bit about Push Rim Foundation and how can people find out about more and how to get involved. And if you're in other states than just here in Southern California.
Yeah, so basically, like Bobby mentioned, Shawn, Push From Foundation, we're just another organization,
Not
nonprofit
just another.
organization.
You're a great organization. Not just
Well,
another.
thank you. That we're based out of LA, LA County and surrounding areas, but we're accessible, and we always like to open our doors up and keep an open mind to helping people outside of our zone in the way of mentorship, research, support groups, and a few other programs we have on our website. But the main thing is to when you get involved in community building, social networking, especially in the nonprofit sector that helps people with disabilities, like we're all involved in. Um, we highlight everything that's available. Christopher Reeve Foundation, Triumph Foundation, SCI Network. I mean, there's so many others that you grab a little live to row. You know what I mean? There's endless amounts, and you're always going to get nuggets of information everywhere you go.
Yep.
So that's the beauty of it. It's not one stop shop. It's a one stop shop maybe to discover many more, right?
Mhm.
That's how I like to put it. So, yeah, check us out, pushfromfoundation.org, and anyone has any resources they'd like to tap into, email us, and we could. If we don't have the answers, I could always reach out to Bobby or Shawn or other organizations to get you the right link and help you out.
And something unique, and for anybody in other areas that might want to start this, but Ray and his fellow team, sometimes when they hear about somebody who doesn't have a chair or a power chair, they go out of their way to help somebody. Get a loaner or a permanent wheelchairs because they're out there. People are giving them away left and right because of family members passing away and they just don't know what to do with it. And so, if you look right, you can find a bunch of power chairs. And then, really, I want to toot your horn, Ray, is you guys go out of your way for something like that. Plus, also all the resources. Ray is abundant of resource, and so they really go out of their way to help people with resources. And back in the day, you have to check them out on YouTube. Ray had his own podcast with a couple other folks, and they would take their podcast or their YouTube channel and did have a lot of great guests. Their first guest, he was amazing. So check out their first podcast because that was an amazing podcast when because I was on it. No, but
Of course.
how many did you guys did? Like probably over 100.
No, we're close to like less than that. We had 100 scheduled, but more like 40. But it
Oh,
was
did
more like inspirational stories. Sometimes it was just a variety type of show where we gather inspiration from others in different ways, right? So that's what it was all about, really.
I thought you did more than that. It seems like you had
Yeah,
more.
yeah, yeah.
But yeah, some great stories out there. Some probably still some good information that you can get today. Very well clean, and so check out their YouTube channel. And Ray, and thanks for coming on. And it was always it's a big pleasure to have you on, and a good friend. You're always Ray and I go back many years. Met shortly after you got hurt, I think.
Oh yeah, yeah, yeah. Absolutely. No, Bobby, I'm grateful to be around you and being part of your life and all the different adventures we were involved in, and we will continue to do so, and we're only a phone call away or a 25-minute drive away. So yeah, thanks, Robert.
Yeah. And I think somebody in the chat asked how to get a hold of Angry Quad. He does have a YouTube channel, so maybe that's a way to get on his YouTube channel and message him that way. So
Yeah, look, you can look him up through his. Just look up
yeah,
Angry Quad; it'll come up. And then I do have Ray and Pushroom's Instagram and YouTube down in the description below. I'll make sure I link the website. I already pulled it up and copied it, so as soon as it's over, I'll make sure to paste it into the description so you guys can check out the website as well. But yeah, thanks, Ray. We definitely appreciate everything for coming on the show, plus everything you've done for the community. Like I said at the beginning, you've been somebody I've been wanting to get on here since like the last couple of years. I think I've been like I need to have Ray on. Leah like, when are you gonna have Ray on?
Yeah. So Shawn, I'm very accessible. Bobby knows that. If you guys ever need a fill in, if you hit me the night before, usually I'm pretty good for it. I have a lot of flexible time these days to do some of that. Other than doing some gaming and going out catching some bass, I mean, I make time for my people and make sure I could sit in on one of your awesome episodes.
All right, well that sounds good because yeah, we'd love to have you keep coming on and doing some extra hosting and things. Just filling in. I know you have a vast array of knowledge as well too. You've been doing this a long time and living the life and just been helping the community for a long time. So yeah, we appreciate you, and thank you everybody else in the chat, everybody watching. Let me real quick too. We can run
and
through.
Shawn, yeah. And before you do that, Shawn, just real quick, they were talking about flushing, and then I saw something about bleach flush.
Oh yeah,
Um,
I've
don't just
never.
want to go-
I don't recommend that. I don't think. I think you should
yeah, talk to your urologist
contact a
about
doctor.
flushing.
Don't put bleach in your body. I don't think.
Yeah, especially not
Cleaning
gay.
a leg bag with a little bit of bleach that's fine. That's good. Make sure you
It's
rinse it
better
out.
to use vinegar.
Vinegar does
So,
work a lot for breaking down the sediment and stuff that builds up on the edges and stuff. But
as
yeah,
well
I
as
don't
well as vinegar to
recommend
flush,
putting it in your body.
and as well as vinegar to flush, but you don't put that much. So talk to your urologist. When my urologist brought it up with me, he said just like a syringe of 10 cc's and put that into and fill your glass half with water and flush it that way. So talk to your doctor. For me, trying to flush my catheter just didn't. It more gave me a headache all day because of it just only put pressure on my bladder and it just didn't feel good.
Yeah, no, definitely. No,
I love that.
but all right, yeah. That's some people do say that you can put ingest bleach and other things. But I do not ever recommend that. Please consult a
No, no.
doctor.
Oh, and it's okay to stare at the sun too. So it's fine
That's
with that.
also yes. Don't- All right, guys. I'm gonna quickly go ahead and shout out and thank our sponsors again here. Um, we really appreciate mobility professionals and urology professionals for helping us stay active, stay on the air, keep providing this little bit of a community and being able to do it. So yeah, we really appreciate mobility professionals. They're a local DME here in Southern California. So if you need a wheelchair, commode, standing frame, anything like that, any equipment, and you're in the Southern California area, give them a call, contact them. They can come out to you. They'll help you with insurance and all that stuff. And one of our good friends, Dean McCabe, is awesome, works there at Quad, and they have a lot of insight and help the community. And then Urology Professionals is their sister company, and they're nationwide. So if you need catheter supplies, they can ship them anywhere in the country directly to your doorstep. So get in contact with them. They can help you out with getting everything set up with insurance and going. And we also appreciate Leo. Want to make sure we also shouted him out, like the owner of the company and one of the receptionists, Don and Monica, came over and helped us hang the banner when we were setting up the booth at the Abilities Expo. Because it was just Leah and I, and so just appreciate they just all around helping and contributing. So yeah, we appreciate that. All right, and then coming up on the channel this week, tomorrow, I think Tom should be feeling up for it. Tom should be doing another live cooking demonstration, talking some life skills, kind of showing how he prepares some food for himself in his studio apartment. So make sure to check that out. They're really cool, fun streams and nice just to hang out. And he will also pretty much answer and talk anything you guys want to drop in the chat and talk. It is just kind of a hangout session with Tom. So make sure to join that tomorrow, 3:30 p.m. And usually goes for a couple of hours. So make sure to tune in there. And then this Thursday, we actually have Rolling with the Golden Oldies coming up. So we got the ladies talking about aging with a disability. I'm not sure. I don't think they have a specific talk or that. I'm not sure. I'll have to actually text and see. But they always have some great insight. They have a lot of experience in the community and living life with disabilities. So make sure to tune in and check them out. And Mickey has been in the chat. Also, shout out to Mickey, who is one of the golden oldies. She's just on hiatus with taking care of health stuff. So that is.
She did have her surgery. She's doing good. Keep getting better there, Mickey.
Yeah, we definitely hope you a speedy recovery, or wish you a speedy recovery. And then next week, Bobby will be back again with Rolling Over the Hill, fourth Thursday of the month. So or the second Thursday. I don't even know what day it is anymore. Oh yeah, it's April Fool's Day.
Also, we didn't even do anything.
I know, he didn't even do anything. I actually had Leah reminding me at the beginning too. And we actually looked up and saw, I wanted to mention when Tom was on, it's also known as Tomfoolery Day. I did not know that. Tomfoolery Day, April. But check out the guys next Thursday, talking about aging with a disability and just all kinds of great life tips and skills and tricks and all kinds of stuff for you guys. And yeah, that's about it for these next couple weeks, you guys, coming up. We appreciate you guys watching. Ray, appreciate you hanging out with us.
Yeah, thanks
and yeah, I know there was a couple other ones. I don't know if we even got to all the questions. The chat was going just really fast, and I was trying to highlight some. If we didn't get to some, I'll try to look through and see, and we can get to them maybe in the like open discussion Q&A at the end of the month or something like that.
And remember that Live to Roll does have a Instagram, and you can message Instagram. You can message me at Robert Rohan is my Instagram channel or handle or whatever you want to call it, 10-4 Good Buddy. And then also Ray at Pushrim is his Instagram. So if you have any questions that we didn't answer, and how awesome is this? 41 people. The chat was going so crazy. We were giving all such great information and good discussion. It was hard to keep up with you guys today. So thank you so much to all the love and support that you keep showing us every Tuesday. And If you have something that you want us to talk about or try to get somebody on, please let us know. Message us in the chat or on our Instagrams.
Yep. Yeah, and the Instagrams are all also ours and Ray's are also down in the description. So make sure to message if you guys have any questions, and then to follow and reach out to Ray and push him as well. So thank you guys all for watching. Appreciate you. And Ray, don't hang up right away. We're just for a second after here. But thanks everybody. We'll see you guys next week. Live to roll.
Woo!